So, how has your experience been with regard to the effectiveness of carbetocin versus oxytocin for the prevention of postpartum hemorrhage?
Before I answer that, I would just like to declare a multicentric, double-blind, randomized phase 3 trial on the safety and efficacy of carbetocin versus oxytocin in prevention of uterine atony after cesarean section. So I would like to declare that. And we found during our study, we found it non-inferior, equally good as oxytocin in prevention of postpartum hemorrhage and cesarean section.
Could you mention about your experiences related to the additional need of uterotonics, uterine massage, and blood transfusion with carbetocin when compared to other uterotonics?
Compared to the other, it is always dose-based, oxytocin, and the efficacy is also how stable it has been or how well it has been stored. So that point is, that fallacy is not there with carbetocin. And hardly any patient required, additional oxytocin in our case, in the study that we were doing. So probably it was related to the stability of the compound. And I would also like to mention here that the first use of oxytocin is this thing. So as early as 2017, RCOG had, cited a Cochrane review from 2012 showing that it is equally effective as oxytocin. And then 2018, the German guidelines and the National Canadian guidelines, they have also used it as, as good as oxytocin for primary prevention of postpartum hemorrhage, not only for treatment, for prevention of postpartum hemorrhage. And then very recently in 2022, FIGO has also said that it is an excellent drug for prevention of PPH, and they have also recommended its use. So all the, not only just my own experience, all the studies have also validated this efficacy of carbetocin. And personally, what I feel is that many people have this apprehension of not using because of the cost factor. But practically, when you compute the total cost, because when you use oxytocin for for prevention of PPH in a very high risk patient, it is not just the active management, that one ampule that you give. You just put her on oxytocin for another 6-8 hours, or maybe sometimes even for 24 hours. And then you need to put at least 4 to 6 ampules. And that, that drip, 4 to 6, that finishes in 4 to 6 hours. So that's 16 rupee per ampule into 4 to 6 ampules, plus that, the saline that is going in, or the dextrose that is going in, and the number of times, the number of changes that the personnel is required to do. So all that adds up to a lower cost and higher efficacy in the long term because of the storage issue. That's my personal experience.